Welcome to Heartbeat on Zim Paper's television network, your show on all things health and development, because your health is your wealth. My name is Robert Mkondiwa. Thanks to our partners SAYWHAT and Swedish Embassy in Zimbabwe for continuing in sponsoring this program and helping amplify the voices of millions of people who would otherwise not have a voice and a say in things and issues that affect their own lives. Now today we continue on a trajectory we started a couple of weeks ago and shall be running for more episodes in the series beyond today, as it has proven to be extremely topical and important to you. Having noted with concern key issues raised here and anxieties of students as well as the absence of their voices in the discourse, our partners added more episodes to this series to demand adequate full closure for students, hence this 6-part series. Thanks yet again are in order for our sponsors SAYWHAT and the Swedish Embassy in Zimbabwe. We are putting the student on the COVID-19 agenda and bringing them to the heart of the discussion. This week, we continue looking at how the COVID-19 pandemic has impacted on especially tertiary students and their parents. And in this episode, we are pleased to have a Dean of Students who shall be getting in touch with us from the Harare Institute of Technology as we unpack the pragmatism, of course, of e-learning, which everybody is talking about at the moment. We also have a parent who also comes to add her voice to this conversation as a key stakeholder, because we've also left those out. We're also joined by Sendisa from SAYWHAT, a cadre who has worked with students for years and appreciates why it's important to give them voices. I will now allow my guests to introduce themselves and their place in the student matrix that we are currently discussing today. I'll start with the lady. Welcome to Heartbeat.
Thank you, Robert. So my name is Tendai Maradze. I am a mother to a 20-year-old who is in university. I also have a niece who I take care of, who is actually studying at university at Bindura University. So I'm happy to be here to share my voice.
And we're glad to have you. Indeed, we have been talking about this, and we talk about having the student's voice in this matrix. But a student is not a student without a parent, and we may have overlooked that. But thank you for joining us today. Sendisa, always a pleasure to have you, and you're back again, and we're talking things that you're very, very passionate about. But for those who haven't come across the great Sendisa, please introduce yourself and how you are a part of this matrix.
Thank you, Robert. My name is Sendisa Ndlovu. I'm with the students and youths working on reproductive health action team known as SAYWHAT. I've been working with students for some time, and I'm happy that this show particularly brings the attention of everyone, the whole world, Zimbabweans included, to focus on students. Their interest in this context of the COVID-19 is very important for us, but also specifically to mention that I'm visually impaired, and I'm saying this because I do also inform my point of departure today to then bring the discourse of disability in general, but also disability in the context of students and universities and tertiary institutions in Zimbabwe.
Well, thank you so much, Sendisa, and we hope, of course, that we're going to have that different perspective, because it seems there are a lot of perspectives that we kind of overlook. We have this generic understanding of a student, and yet we're very diverse, different and rich people. Now, the country on Wednesday witnessed a spike in cases and now has 132 COVID-19 cases. Now, this comes at a time when tertiary institutions are making arrangements to open. In the wake of these developments, key questions: will they still open soon? And there seems to be no position from government on a uniform approach to the opening of institutions, with all responsibility being relegated to institutional level. Now, this discord can only further worsen the students' dilemma. And of course, a couple of weeks ago, we had the permanent secretary in the relevant ministry coming here. He really helped us unpack a lot of information, and we still have a lot of questions. And of course, we shall still take all those questions to the relevant authorities for you. But as a parent, you are hearing people saying they want to, bring your kids back to school, back to university. And of course, there's always going to be apprehension because these were quarantine centers and until very, very recently, and we don't even know whether they have ceased to be. So never mind the fact that in the matrix is the fact that there were people who were potentially COVID-19 positive in those institutions. Now we hear that we have this fresh explosion of COVID-19 cases. What does that say to you as a parent?
It's really a dilemma, I would say, Robert. It's a struggle for a parent. I would want my children to complete college. I want them to complete within time. So this has always been the plan. They're supposed to finish their first year at this point. But now that COVID has been thrown into the mix of things, we are all in quandary. My challenge is, when universities, colleges and schools closed, we had 4 cases. Now we have 132 and we are planning to reopen. As I was coming here, I was listening on the news and I heard people in quarantine being interviewed, and they were saying we've been in the quarantine centers for 14 days and we haven't been tested. So that means there are a lot of gaps in the response to COVID by government. And so for us to then now say we are going to reopen schools when we haven't even done the most basic things, it's a real challenge. So for me, the question is, do I want an educated child or do I want my child to be alive? So it's a catch-22 for parents. I know that there is this push to reopen, but I don't see the preparation. I think it would be good for us to understand how prepared government is, how prepared institutions are to welcome the students back. What measures have they put in place for us to be sure that, A, B, C is going to be taken care of? If there are no measures in the quarantine centers, which again, as you've said, some of them are tertiary institutions, are schools. What about, bringing back over, thousands of students back so they can sit for exams? And
that is the quandary, isn't it? Because if we locked down and pretty much shut down a country because of 4, 5, 8 cases, and we reopen when we've got this explosion, and we're comfortable with the so-called level 2, which in all fairness is level nothing, because we've really gone back to factory settings. If the traffic on the street, the human traffic, the vehicular traffic is anything to go by. So if we're going to shut down for a handful and think we're fine to be open for, that whole big number that exploded yesterday, that beggars the question as to what is informing our decisions. But going back to the beginning, as it were, when COVID-19 struck, how did that affect you as a parent? Because there you are. There's a lot of planning that's involved from the beginning. The children have to write when they write. There's a lot involved that you put together, especially including going back to the next semester and putting together money for that. And you know how difficult it is. And some of you had already paid for semesters that children, or rather students, had to be recalled from. How did that impact you then? There was a huge impact emotionally, socially, and economically. You needed to understand that my child is in danger. I don't know how much more can she stay in college without coming home. So there was a lot of push for the students to come back. But now this push to go back, we've gone through almost 2 months of lockdown. Parents are not, some of us are not working. Personally, my income has been cut drastically by the lockdown. So now I need to prepare my child to go back. And now this preparation also requires much more, because they need much more. They need, sanitizers, they need
the masks, the requirements that are now needed for parents, and there is no backup, So we are not going to get anyone to support parents to ensure that as children re-enter college, they are going back with a good, a holistic package. Basic things like sanitary wear for girls, actually. It's so expensive. Prices have skyrocketed. You need to get your child back in school with a full package. So it's really a crisis for the parents. It's a crisis for parents who have traditionally been struggling, and now the struggles have only quadrupled, if I would say.
Yeah. Well, interesting. A lot of people are talking about going back to, or going to something called e-learning, and we went and talked to students around the country. We went to Masvingo most recently, and one student, Tafazwa Mkono, who's a master's student, cites internet poverty as one of the challenges, even when they have to learn from home, and says students do not even have some of the gadgets to use for e-learning, and argues that some modules are too practical for e-learning. Let's see what Tafazwa Mkono had to say.
I think lockdown first of all, I think academically I got to affect because I'm a block student. We're supposed to start sometime, I think, in April, right? But because of the lockdown, we couldn't come to school because the Pampa Tetwa, that 2-week national lockdown. So my challenges that have actually arose from the time yakatanga lockdown, it's generally communication between those block students and their departments. It took us a while to resort what are we supposed to do but eventually I think because of the e-learning programs that have been put in place, some are still even struggling because of data charges. I think but then I think the struggle is really real because you find out technology wise wasatu wanyaso one accesses laptop and then you find out that you have to submit your assignment on Google Classroom. So these are the challenges we face, and some of even my modules we've been taking really they've not been designed in a way that too practical, so over the classroom e-learning they may not be as effective as it would have been in a class or in a lab. So I think these are some of the challenges that we as students, as any other student, has actually faced. Uncertainty as well for the final years students. Are they going to finish their programs? Are they going to have their diplomas or certificates, or are they going to graduate generally? I think those are my challenges we will just find with just the lockdown on its own.
We're being given by a student talking about e-learning and all their challenges. And perhaps let's also look at another student from Masvingo. Now, Melvin Chikurumane is a student from Masvingo Polytechnic. And she says she's anxious and has not heard from her college for them, and they have no e-learning platform. So while we're talking about e-learning, this and that, one says they may have the platform, they don't have the gadgets, but here's somebody who's actually saying, as a polytechnic, they don't even have that platform. Let's hear them speak.
Studying at Masvingo Polytechnic, doing tourism and hospitality management, national diploma level. I was about to start level 3. We're supposed to start this term. In fact, we're supposed to start this month, May. So now we're not sure what's going on anymore because schools are not opening, or at least they are not. So nothing is clear as yet. And it's also unlike my universities. At Nama e-learning portals, universities have been covering ground, but Isusu we are just stagnant because they have anotanga muna January. Term yavo yakagurwa, but not much because the younger started a few weeks. But their year is affected greatly because we are not paid November. So they were supposed to, in tourism, we do practicals. They were supposed to be doing my practicals in preparation for the exams. Saka, without a practical cooking is complex. It looks easy, but you need to learn. Of course, we will be using Edu knowledge from attachment, but you know it's just necessary to go to class. Saka isusu we have that disadvantage yokuti pana polytechnic in e-learning portal. Saka we are sitting ducks. We are just in the dark, like kutongonzwa from others kuti saka zvichadi. We are all just guessing. Otherwise, there is no formal communication between the admin and the students. There is nothing.
Well, there you have it. A lot of questions there being asked by the students. Now, before we proceed, I'd like to welcome the Dean at the Harare Institute of Technology. Thank you for joining us. Could you just introduce yourself before we continue with the program and, of course, get into what the students were saying?
I'm CHANDAUKA Joshua. I'm the Dean of Students, HIT. I think that's about it. That's
just about it. Well, you are the people who are actually also using the COVID-19 period to get. I hear you worked on a ventilator. You're also working on things like sanitizers, and this is something that, of course, has been applauded on our ZTN platforms, and congratulations on that.
Thank you.
Now, there's been a lot of apprehension. Now, we'll go back a bit because parents are saying before yesterday they were apprehensive about sending their children back to school because we're opening up a little bit. Certain years of college are going back to college onto the campuses, and they were already apprehensive that some of these places were being used as quarantine centers. And now that we've got a new explosion of COVID-19, they feel they cannot feel absolutely comfortable to have the students go back to school. What is your comment on that? What is your how do you deal with that sort of apprehension?
It's founded. It's based on what they see and hear, and at the same time we can't be spectators. I think what is important is this is not a Zimbabwean or a Harare Institute of Technology issue. This is a global issue. And what you want to do is talk about it and do it to be involved, to solve, to proffer solutions, away from politics, away from any kind of narrowed solution. This is about 192 institutions affected globally. And you want also to check from left, right, and center what is happening. And you profile a solution, you try it. If it doesn't work, you look back. But you can't just be a sitting duck.
And one of the solutions you've proposed has been e-learning. What brought you to at least that conclusion that you can use that as one of the alternatives, as one of the solutions to the current crisis that we have?
Again, e-learning is not new. E-learning is not about Zim. E-learning, that's where we are going. And we have to go there. And if you want, we don't leave anybody behind. This is their slogan. But excuse me, you'll be left behind the whole country. Now, so let's move on.
Okay. Now, that's important because there are people who will be left behind. Now, Sendisa, you were somebody who was born with your vision and you became visually impaired. And you can tell us your experiences as a person, how life was when you had your vision and how life is right now that you don't have your vision, and what you think of e-learning as one of the solutions, and whether you think students who are in a situation that you're in would necessarily not be left behind.
Yeah, thank you, Robert. I'm happy that I'm also having my dean, my former dean at the University of Zimbabwe. He saw me when I had sight, and then I lost sight in 2008. So I think one of them, and I like the tone that is already driving us to say, let's talk about solutions. Let's try things, let's fail, let's rearrange, let's realign, let's move forward, and let's do it collectively together. Students, parents, and including those sub-populations who usually are projected or presented as vulnerable. So the starting point is if you were born without a disability and you have a disability, the starting point is rehabilitation, and your ability to use certain devices might be compromised. So as a solution, and using my experience, up to now I can use Braille. I rely heavily on the laptop and an assistant. So that context will bring us to say, if we're going for e-learning, how is the home environment conducive for a person with a visual impairment, for example, to support e-learning? You will definitely need what a software called, it's one of the softwares called JAWS, Job Assisted with Speech Software, so that you can have access to the screen, access to the notes, access to Googling, and usually our current situation is we were having those in institutions. I know my former dean, he was part of the process where the University now of Zimbabwe has Disability Resource Center. So the model that was being used was to say students will come in their physical presence, they go to a Disability Resource Center with all the assistive devices, equipment, electronics, and everything. They learn and they go home for vacation. So it's the other way around now. Home has become university. Yeah. Home has become college. So we have to then broaden our minds to say, what assistive devices do we need for the home to become a super college? And then we move with everyone in a way that will not probably not put a lot of financial pressure on families with persons with disability, because already they've got this other different layer. You know, if a person has a disability, there's the financial layer of your wheelchair, your walking stick. You're not able to contribute economically to the family the way other people who are able-bodied can do. That means there's that mismatch in terms of financial responsibility between families with a student or a young person with a disability and families who have got able-bodied students or young people. They can be converted into economic assets in that family. So the whole context now is, I agree with the dean, let's go for solutions. This is a global pandemic, and the truth is COVID-19 is here to stay. Just like any virus, you can't wish it away, you can't sit down, you can't remain stuck and be sitting ducks forever. We have to stand up and square and face it shoulder to shoulder and head to head.
And we also heard the other context where students were saying they cannot, some of them don't have the gadgets, some of them cannot afford, especially the data costs. And we've got a parent here whose earnings were slashed, perhaps directly or indirectly, because of COVID-19, which has had a very big financial impact. And never mind the fact that they then may have a student who is physically challenged, as we were saying, because now it's a very big economic challenge. Was the introduction, or has the introduction of e-learning, for example, not come rather too quickly? Should there not have been some sort of roadmap to e-learning that remembers the physically challenged, that remembers those families that already were struggling to raise money to send their children, never mind the fact that they now have to buy data and everything? Because it seems we said, we're starting on this day, this is what we're doing, and never mind the fact that Mrs. A may not have money to buy a gadget, Mrs. B may not have data. When can we all start at the same time without prejudicing those who are haves, but also without stifling the have-nots? Has this not been a bit rushed? And I'll come back to you as the parent, for example.
Yeah, indeed. I think we needed to do some feasibility as a country and for institutions. I know students who come from this is their home. So this is what they call home. They don't have access to electricity. So there is no Wi-Fi access. And for you to get data, you need money, like we have said, and there are real issues around that. Rooms or one room, and it's a family of 4 or 5. So from a feasibility perspective, indeed, like I said, as a parent, household. So really completing college is critical. And as Zimbabwe is put savings behind to ensure that a child goes through school. You know, growing up, parents would sell cows, they would sell assets to ensure children go through school. I'm just not sure at this point that the leaving no one behind together, I don't think so. There are some few kids who can start on e-learning and actually use it full throttle. But the rest, you know, WhatsApp is not good enough. And even for the WhatsApp, most of the students do not have WhatsApp. And we just heard a student talk about practical lessons. How are they going? They need to practice.
And they're coming to you, telling you the same concerns that were raised by a parent, the same issues. That because, as you rightfully said, some come from the back of beyond, and that's the majority who come from resource poor countries because of our demographics and our LSM and the likes. What if the e-learning train starts moving?
The last part is okay. The first part, I want to be very sure that we are agreed that this is a pandemic and it came and there are three fundamentals that are disturbed. There's the issue of student disruption. There's no question about that. Not just Zim, all over. The second one has to do with what solution do you have? And it doesn't fit all.
Yes.
Okay? And then there's the third part, which is what she alluded to, the issue of dropouts. There will be dropouts. And we want to minimize that. We want, where possible, eradicate it. When we say e-learning, we are not saying online. Let's get that also right. E-learning has got some aspects which are not online. You have SDs, storage devices, CD-ROMs. You've got a lot of aspects that are e-learning which are not online. So that's another solution. There are simulations. If you talk about e-learning, there are simulations. Our challenge, very big challenge, is that the pedagogics, the teaching part, how to teach, even the lecturers don't know. So let's teamwork. The lecturers preparing a slide on a webinar is different from preparing on face-to-face. So all those things are challenges. Let's face them head on. Einstein says, you fail when you don't try. Yeah, you keep on trying.
And that means we've got, you've just widened our crisis, because even as you said, the lecturers, it's a learning curve for all of us, and coming up, of course, with even Zimbabwean solutions to a global pandemic, because what may be a challenge here in Zimbabwe brought about by COVID may not necessarily be the same in, for example, South Africa or in the first world. But going forward, you raised something before we saw the students speaking about that apprehension. Will our children go back to school? But even if they do, our family economic fundamentals, all right, what holes and gaps do we have? And it's interesting you even mentioned menstrual wear, today being World Menstrual Health Day. And it's a very important something. But when we talk about leaving no one behind, we seem to forget that there is that person who's visually impaired, but there's also that person who's a woman. And that has been made to be some sort of disability, because if you don't have your dignity, because you cannot afford sanitary wear, that leaves you behind one way or the other. How would you see that perspective as a woman, as a mother?
It's a tough call, Robert. It is sadly Zimbabwe. When I went to college, there used to be student grants. There used to be some cushioning for students, which is not available now. So for me, that's the huge gap. Indeed, really, you know, the world has moved. We are moving to online. We are moving. People can do distance learning. Even when I was growing up, there was correspondence. My father used to work for CACC, which was a correspondence college, and people could get booklets and take them home and do correspondence. So there were opportunities. But I think the real challenge that we have as a country, and which we should not try to hide, is that our poverty, our levels of poverty are just appalling. We have way too many households that are struggling to get the basics, to get a meal on the table. So when now we talk about menstrual health for a girl, for a female student, then it becomes, you know, a luxury actually. So it's sad that even as we talk about going back, you know, getting students back onto school, there are going to be additional layers of financial resources required for parents, for households to cushion the students, and households are already struggling. So I think for me that's the big elephant in the room.
And you talk about that, and it's interesting because I've got a story that I dealt with, a real and tragic story, which talks about, as you mentioned, energy poverty, for example, that there may not be electricity where somebody comes from, or certain layers of poverty. And this young man lived in a family where they shared a single room. And as a young university student, he had to go next door for his sleeping arrangements. Now, COVID-19 says people don't want to mix with you. So you're going to have those people who would migrate because of energy poverty to go to an urban setting, to go and live with whosoever, have access to internet, have access to, for example, the energy, who we're going to be reluctant to take back because we don't know what you've got. We don't know, we can't, because this is essentially a health crisis. And we should actually at least spare a thought for children like that who really can no longer be accepted, because one of our strongest points in Africa and Zimbabwe in particular is that we already had a social have even brothers asking, where were you last night and who have you been mingling with, because we don't know what you brought back for us. Poet, he speaks through poetry and spells out his fears, challenges and impact of COVID-19 during this lockdown.
Prevention is better than cure, sure. Tingaira paneko. Denda iringangopera votakakwana kudai zvaakatya makunguo mangani tomagadzika pasi tikasafamba anososona here. Paradza rokubasa vachiti niyanduri wenduri dzinoti turi mambo gura matunhu. Indri student pa GZU pa but handichakwanisi nyaya kuti kuungana kwakadi kwakarambidzwa, but murume ashai zvekudi zvokuita, ndaakungomaketawo hatiri kutadza kunatso kuadjusta kuti tisute zvavapo.
A very heartfelt message there. Now, Dean, that's not your student. Also helping out with the bills because of going around and doing what he did as an MC and everything else. But also that improvising and saying, you know what, I'm going to take this online and get jobs. And you really have to feel for somebody who's trying
already got solutions. Build on them. Look around you. The HIT initiative in and what we are saying is thermometers. We can do that. Why did you go to university to do electronics? Ways of doing it. Let him teamwork. It's teamwork. Let's not continue to compete. Parents should not compete unhealthily with the lecturers. Students should not compartmentalize a problem. It's not a silo. Let's break the silos and become one. Teamwork. Where you saw us on CNN, we are being conducted with the Afghanistan, so that the ventilator we tried to do, we can compare with Afghanistan. Teamwork. So where am I? Proffer solutions, SWOT analyze. Be an incentive for you to get even higher results. That's my message. The first step you make after falling, that matters. Yeah. So yes, here we are. The pandemic is there. We must not lament with that.
Solutions that you're also working around with the students. Tell us a bit more about what SAYWHAT does and what you're doing and how you've also been nudged to get into other areas beyond what you ordinarily do in your programming.
Yep, I think the starting point is that the pandemic also has brought other opportunities for dialogue for SAYWHAT. To say at the center of human development is also equally important to then focus on people's health, because even if you talk about it's very important now as we move forward, as we proffer solutions to say, how do we make our institutions healthy institutions that produce healthy students? Not only talking about HIV, but healthy in its totality. Because now we have is also working in partnership with other partners, is to say, let's get if you look at COVID-19, communication. So our behaviors now have to change, but how do we communicate in ways that does we are seriously relooking into our models of reaching out. People now are seated at home. The ZTN way out of the hall, and then you stop through to the dean is our authorities should come to the forefront and give information so that we break the silence. We remove the they've been already into researches. You know, we know models, Robert, that work. For example, from where I come from, to put ramps because my problem is vision. I don't use a wheelchair. But when you see that, okay, a person with a wheelchair can't enter a house of a person who does not see, that means I should reasonably accommodate that house, put a ramp for someone to enter. So universities should be giving models of saying, how do we make institutions safe to learn from, so that other smaller entities where there's no strong research, like schools, primary schools, secondary schools, can adopt those models. So for example, you can do a COVID compliance audits for institutions. Which places are high contact places where there's a high student movement? And what equipment do we put there? What messages do we put at the DH to maintain and remind people of the COVID-19? How do we realign the library so that people can read in a booth where there's screening, you are in your own booth? Or those small solutions, they give people a kind of sense to say that we're going back to college, to university, but our safety is also guaranteed. And universities have got that special role. I'm saying special because they've got the resource already. Students are a resource. Beyond their vulnerability, they are a resource. You can run a competition, and that's where partners like SAYWHAT can come through. Let's go for a competition to have students design a COVID-19 compliant university. And our deans will pick it up. We polish the best ideas, we give information what model has worked, we try a certain model, we give feedback, what has failed, and then we move on as a country. So I think the most important thing is let's begin to establish partnerships where people don't do their things in silos without giving information of what they are doing, but that will definitely create anxiety. And fake and false news will definitely circulate. There's a lot circulating on social media about these quarantine centers, are they safe? What is happening there? Will the universities open? So our ministers can also come to the party and say, how do we coordinate our voices as tertiary institutions to make sure that the beneficiary of that entity, the student, is aware of what is happening. They prepare in time, parents prepare in time, students prepare in time. Everyone, we propose adjustments and we adjust and we move on, which is important for me.
Information. Absolutely a very important something. And I believe, Dean, this is something that comes to you a lot. Your students are asking the questions that Sendisa was asking. Are we reopening? When are we reopening? And I do know we were talking to the PermSec for your relevant ministry, and he was saying, well, there are different models and different reopening pathways or roadmaps for different universities. Do you have anything, what answer are you giving students at the moment with regards how your particular university is proceeding with the reopening models?
I've just come out of a meeting with the students. We have had what we call Student Affairs Committee, and I'm coming from there. So they expressed their views. You can't have fitted all answer. We are different. So like the PM said, you can't, well, there will be models.
Exactly.
It's important to come up with solutions and we share. We have webinar seminars and Zooms with our colleagues. We do share with the Africa universities. African universities have got an association. The webinar I've just, today I am not on because I'm here, because they broadcast and we share across Africa what is happening. Sarau, this is the Southern African University put together. The vice chancellors go there, we come and share and come up with which model worked well. You look at WITS, they had to give their students a bundle and so forth. That's a solution. We don't know what Kenya is doing. You need to read through that. You need also to hear them speak and set up conferences if you can on webinar or anything like that, so that you hear. You have no monopoly to solutions. So it's important to synergize, and it's important to hear parents speak. It's important to listen to the students. But for my students, offer solutions. No matter how wild, bring those up, and then we can panel beat them into solutions that may be very useful, pragmatic. It's no longer time to theorize too much. The issues you mentioned, because as we go on, I've got students who are from the diaspora. They have got to be in a quarantine if they come into the country. By airport, they will be told you are staying here for 8 days, and so forth. So these things are important. So
currently, you have no released roadmap, or
we have some of the things are not ripe for this forum, but students have come in today because we couldn't meet because of COVID, but we wanted them physically there so they can see what we have done and the route that we are taking. The frequency of disinfection of important places like toilets, issues like pathways, how often do you, and how do you know it has been done? It's not enough to talk about it, but we want to see indicators that it has happened. You want also to make sure that the disinfectant meets the standards. The sanitizer, we are lucky, we manufacture sanitizers. So we are saying it has to be quality tested. So we have those issues. Students you are talking about, those that are poor can also come and work in the factory where they're making sanitizers, but of course limited hours. Because so it's important to say there is no solution that fits everybody. It's important to say that, and important to recognize it. And it's important that your solution might be actually inferior to what is happening in Bindura. So you must be ready to change. We are in a disaster, state of disaster. Let's accept that. And that we may have the commodity called time, very limited to us. These students want to go out, and so we don't have the time. And time to quarrel is not now. Time to conflict, yes, because out of confliction comes ideas. So conflict is the seedbed of new ideas. So let's conflict with the students, with the parents, but at the end of the day, we are a team. We get a solution.
And speaking of conflict, we were talking about e-learning as a solution. And some of the students who we talked to, who of course spoke on this show from the various areas that we went to, were saying it's not a solution for them because they were citing data challenges and what have you. But LYNETTE HONDO is an information systems student, and for her, e-learning is not really much of a challenge, though she fears some of her peers may be left out due to internet poverty. She is already working on a project on e-health. She says the online platform virtually brings the healthcare worker and patient together. This is what she had to say.
Not everyone is involved. That's the disadvantage of e-learning. Considering the fact that data bundles are expensive, if you can't afford them, you can't join a class. Some of us come from backward families like Kumusha or something, so there's no network coverage there. So it's very hard for everyone to join a class. My project is all about e-health. like the online health platform, where a doctor can interact with patient, a patient can get his or her medical facilities from the online or the medicines. Since there is a lockdown, we can't move about freely. So we have to come up with a solution to that, so that when you want to purchase medicine, you can easily order online.
Well, there you have it. While some people may find e-learning to be a problem, she sees it as a solution, and in fact, it is one of the fuels that is fueling her passion to think outside the box, if at all there is a box. So there we are. Some people are actually seeing various opportunities here, and it's also great that again, thanks to our partners SAYWHAT, we managed to talk to these students all over the country, and we got the students from even Bulayo. We've been to Bulayo, we went to Mutare, we've been to Mashingo, Gweru, and we've been getting the COVID-19 story according to the student, and that strange gospel of health and education according to the students themselves. I should remind some of you, if you may have forgotten, if you didn't watch some of our shows, that we even had a situation where SAYWHAT had a student who was patient 21, and COVID patient. I don't think in your programming you'd have ever thought you'd need to give that sort of support to a student and think there's going to be a pandemic that's going to come. It's going to be absolutely dangerous, and we're going to need to help this person or a particular person on our books. But this just happened because we're not living in the most normal of times. So I'm glad to say that people have been following up on her, and it seems most likely that she may have very well recovered. Of course, we are going to be following up on her story. So these are various stories of the strength and resilience of the human spirit. Now, before we close, I would just want to hear your parting shots and what you have to say, for example, to students. Dean, your students are out there today. You're the dean of the nation. You're speaking to students because they're virtually sharing these crises, the apprehension, they're anxious and what have you. And speaking as a dean, a father and a friend, what do you have to say to strengthen the resolve of our students around the country who are watching?
These are difficult times which call for the courage, call for your intelligentsia, since you are in higher education. For example, how do you come to college? You are in Beitbridge. It calls on you to really try and solve. Try the police, try your MP, try influential people so that you can get a letter to go back to your institution. And when you get to the institution, instead of resisting, try and find out exactly what is going on. And if you think we are breaching WHO regulations, the Ministry of Health regulations, you think we are not up to it, come along and say it. And for us, for my colleagues, let us allow for dialogue. Let's allow for students to come in. For parents, be free to talk to us. And I've had parents who can't even send the student because they think it's not time to do that. That's your choice. But let us look at exactly what is happening on campus and find out whether it's safe. If it is not safe, I think you have a choice to say no. But at the same time, look at it from a solution point of view as opposed to just resisting for resisting's sake.
Okay.
Yeah, we all don't know. And so we can't assure you, parents, that your anxiety will be smoothed by us. But we are doing all we can, especially for our institution. We are doing all we can so that we observe the WHO and the Ministry of Health ideas, because they still are very helpful, and we must keep the distance, wear the mask, and so forth. We need to follow what they are saying, the authorities.
Thank you, Dean. It's been a pleasure having you. And Sendisa, what's your parting shot?
Yep, I think for me, what's important is we should now prioritize universal access to health as a key development agenda. What COVID has just taught us is that development priorities are not disconnected the way we sometimes want to think. Education is not disconnected from our health. The environment is not disconnected from our health. So we should begin to go for what I will refer to as systems thinking. We must, at different levels, link things up. At family level, it's not just about bringing food, rice, chicken at home, but it's about talking about our children's health, children's education. We talk about the climate. We make our homes places where our children can learn from in the future, or we also go for parenthood skills that will equip us with different skills to deal and support our children in different circumstances. So COVID-19 is just one global pandemic. But believe me, in the next 2, 3, 4 years' time, we might be having something else. It can be climate change, it can be another health outbreak, it can be an economic whatever challenge. But let's begin to be more prepared at all levels, from individuals to institutions, to development partners, to our government. Let's begin to be more prepared for disasters and national pandemics so that we build people's resilience and we come out of major pandemics with less fatalities in terms of people dying from such pandemics. Absolutely. Very profound. And I always go back to the parent last, because you are really the embodiment of that anxiety that's back home that the students have, and you've got a lot more questions, and you're going to keep asking, and you're going to keep demanding answers. And the Dean said, keep coming back to us, tell the children to ask us and questions that matter, speak truth to power, demand answers, because it's their health that's going to be at stake because of COVID-19, or anything for that matter, because as Sendisa said, there's a lot that's bound to happen. We are humanity, we're humans, and because of our interaction, there will be, it could be economic, it could be climate change. There's always going to be another challenge going forward. What are you saying for and on behalf of both parents and students?
So I think my parting shot is I'm really glad to have been part of this conversation and to hear solutions and moving forward, this energy around, we can move forward, we can do something despite the challenge that we are in. And I'm glad about that. I think the core to a pandemic like this, we are in war. It's really information. What parents are requesting is information. We would want to understand, how, for instance, you are meeting those WHO standards that we know should be adhered to as students re-engage with institutions. So it's a call for that dialogue to come in. During this show, you played a clip where a student was saying, I don't know anything. The institution hasn't said anything. So everything we hear is this short clips on TV which says universities are going to open in 2 weeks' time, and nothing else. And the university that I know, that my child knows, is that old university. So if there has been any changes, if there is a roadmap, then that conversation has to happen. There has to be these communication platforms between students, parents, and institutions should be opened much more widely. We are stakeholders in the tertiary institutions, and we should be given that opportunity. And also, when a death happens in a family, it is me who loses a daughter. What you see, what everyone else sees is a statistic. It's like now we are at 4 deaths. You will not see my child, you will just see some number. So at the end of the day, that is the reason why parents are much more concerned. Some of the concern is about a bigger institution, and it might not have that human face. When my child is COVID positive, I don't see case 21. I see Angel, my little angel, my princess, and so that's where parents are coming from.
Absolutely, because our children are real. They're our palpable beauties, and they're not statistics. And it's because they're not statistics that you gave your precious time, all three of you today, to come here and discuss these very, very pertinent issues, because we want to speak to the dreams, hopes and aspirations of our children, not as statistics, but as individuals who have, of course, their dreams and hopes. Thank you for coming, Tendai. Thank you for joining us and being the parent of, today you were the mother of all tertiary students. And I must say, you did an absolutely brilliant job. Sendisa, thank you for coming. Dean, it was quite a pleasure having you. Thank you so much. And of course, thank you for joining me here on Heartbeat on Zim Papers Television Network on a day when we have closest to our hearts our women, our girls, our mothers on World Menstrual Health Day, because we remember you. We stand as allies, shoulder to shoulder with you, knowing that you've got an extra economic burden because of a country where, of course, sanitary ware remains absolutely expensive, and we keep saying we want to get to free. So from me, Robert Mkondiwa, and of course the crew behind the scenes here at ZTN, we say have a great day, and we hope one day we shall kill poverty. Have a great day.